Dance movement psychotherapy is a form of psychotherapy that uses movement and dance as the medium for communication. Now, the Association for Dance Movement Psychotherapy UK has defined the field as the psychotherapeutic use of movement and dance through which a person can engage creatively in the process to further their emotional, cognitive, physical or social integration. DMP is founded on the principle that the mind and the body are connected and that movement reflects the individual's patterns of thinking, feeling and communicating. Now, the other important aspect of dance movement psychotherapy is that the client-therapist relationship are central. And the dance movement psychotherapist, through acknowledging and supporting the client's movements, he or she facilitates clients to arrive at new understandings of personal or relational issues and achieve therapeutic change. The students we have at the MSc program come from all over the world and also come with very diverse experiences and qualifications. They may have a dance degree, or they may come from a caring profession, they may come from nursing or psychology, they might have been teachers or counselors or psychotherapists. They all need to have experience of working with vulnerable populations in a caring capacity for at least a year, and an ongoing commitment to dance and movement for a minimum of 2 years.
I'm halfway through my first year at Queen Margaret University studying dance movement psychotherapy. My background is in ballet. I started dancing when I was 3 years old, went to the Royal Ballet School at 16, got my first job at 19, and I was working with the Scottish Ballet for 11 years. Just retired from dancing professionally in September and started the course here straight away.
So I come from Poland and I've been in Scotland for about 13 years. And before I entered this course, I have studied cognitive behavioral therapy and become cognitive behavioral therapist and work at the private hospital in Glasgow, specializing in this field, particularly in addictions and general with patients with mental health.
As an MSc, this program supports students to develop critical thinking and an understanding of how to use research in clinical practice. Now, dance and movement is central in everything we're doing. So we're encouraging integrated learning, which means that students will attend a session that has a component of theory in there, that they will be asked to reflect in movement their understanding of the particular theoretical concept, or the other way around, they might start from a skill-based or a practical aspect, and they will be encouraged to conceptualize and theoretically understand it.
I bring to the program two of my particular interests, and one is closest to my heart, and that is a practice called authentic movement, which is a part of the whole movement therapy process of using movement to really be in touch with oneself. And it's a practice where people learn embodiment is an interesting word. It's the experience of being oneself. And they learn to not just make movement or improvise or be creative, but to listen very deeply, and in fact often with closed eyes, just as I'm doing, to listen very deeply to what their body seems to want to say if they just let go and listen.
I'm both a lecturer and the placement coordinator, so I set up the placement education experience for the students, and which means that they're going to be in placement two days a week or 1 day if they're part-time. And that means that I spend time actually developing the placement opportunities and meeting with placement providers, persuading them that dance movement therapy is something they want and would be really valuable. So that's an interesting aspect of my role.
I'm fortunate enough to have 2 separate placements with 2 completely different client groups. One is with children in the East End of Glasgow, a mainstream school. For whatever reason, it's generally home life, have slight behavioural difficulties in the classroom. And my other placement is with adult mental health in Paisley. It's a drop-in centre, and I'm really enjoying both placements. It's great to have 2 really completely different client groups.
I have 2 placements. The one is a school with children with physical disabilities and learning disabilities, and the second placement is a pain management clinic.
One of the things that have been offered to me through this course is a placement, and it's at the residential school in Glasgow for children with autism, where I have been recently placed over the past 3 months. I've been involved in therapeutic work with the groups of children between 3 and 16 years old. There's this particular group where there are 3 children, and they're 9, 10 and 11. And recently we've been trying to do a variety of movements, and I just really find rewarding. It's, you know, I haven't worked with children before, and here I am in a school full with children, in the middle of the room, finding a way that I can connect with them, with the children that, you know, usually they will not give you eye contact.
Queen Margaret offers students the opportunity to study in a university that's fairly containing. I don't want to say it's small, but it's certainly not a huge university, so it's got a homely feel to it, and students can relate in a very simple way to the librarian, to their lecturers, to different bits of the university that will support their learning as best as possible.
After graduation, people may work in health services, schools, the voluntary sector, social services or prisons, or they may engage with private practice.
I want to work in a cardiac rehabilitation in the future, back to Cyprus. Unfortunately, we don't have cardiac rehabilitation centers, so it's going to be a good opportunity to start one.